Okay, we're going to dive in and I'm going to give a short introduction and then I'm going to let Marion take it away. So, for those of you that don't know me, I'm Megan Barnett. I am the co-owner of Bio Lounge. Um, and what a lot of people don't know that I do in the background is I work with CNS or certified nutrition candidates. And what that means is in order to become a CNS, you need to complete a master's degree in the nutrition field. And then you have to be supervised for 1,000 hours of clinical practice in order to sit for your board exam. And so I'm really excited to introduce Marion to you today, and I have had the opportunity and pleasure of working with her for over a year now, as she has been pursuing her CNS board certification. And like many of us, we have special interests, things that come up in our families or in our own health or in our friends' health, and they really drive us to hone in on certain health conditions. That we become passionate about because of personal experience. And so I was thrilled when Marion decided to offer this educational course on cardiovascular health because not only does she bring a really high level of understanding and education around this, but she has the passion that goes with it. So with that said, I want to introduce Marion to you and hand the mic to her and take it from here.
Thank you so much, Megan. I'm going to share my screen and we'll get started. I know we have just an hour, and I'm going to do my best to get through the content I want to share with y'all and have some time at the end for questions. So let me get this. Can you see my screen here? Okay, great. Thank you. Um, so thank you everyone for joining us today. We have something very important to talk about. It's how to protect your heart and strategies that you can take starting today to improve your heart health. Um, my name is Marion Wilding, and I am a clinical nutrition intern here at BioLounge. And as Megan mentioned, I have spent the last year in her very extensive program getting real world experience as I work towards becoming a board certified nutrition specialist here in Washington State. I have been on my own heart health journey over the last decade or so. And so I'm really excited today to have the opportunity to share with you what I've learned about what works in taking care of your heart. So today we are going to walk through some of the risks and causes of heart disease before we spend some time focusing in on the power of early intervention and how diet and lifestyle factors can significantly reduce your risk for cardiovascular disease. And towards the end, we'll also spend a few minutes talking about some of the more advanced biomarkers and imaging tests that you can think about in partnership with your doctor based on your own risk. Okay, so today I wanted to start with risk factors for heart disease. And one thing to note, we can't really talk about heart health without also including the health of your arteries. So we're really talking about cardiovascular health and cardiovascular risk factors. And what I want to highlight in this visual, which is showing you, the common risk factors for common and well-studied risk factors for heart disease, is that there's a small component of risk related to factors that you have no control over, your age, your genetics, family history, etc. But what is really important to understand is that over 80% of the risk for cardiovascular disease are factors that you have the power to greatly influence. So things that you may have heard of, like smoking, level of physical activity in your life, whether or not you're bringing good nutrition into your day, whether or not you're carrying excess weight, especially around the middle. All of these lifestyle choices influence things like your cholesterol levels and whether or not you're able to manage your blood pressure, etc. So my the main takeaway here is that you have the power to significantly influence your heart health. And if you have risk factors, reduce your risk. Okay, so here I want to just highlight the fact that early intervention can significantly reduce your risk for heart disease. And this is like whether or not you are already on a path towards with on your own heart health journey. And it doesn't matter how old you are. It's never too early to start because the research is clear and shows us that heart disease is a progressive, slow-growing, silent disease that can begin as early in the first or second decade of life. And this is again driven primarily by diet and lifestyle factors. So we see in autopsies that kids, even teenagers, sometimes can be carrying like early stages of plaque buildup in their arteries, what's called fatty streaks of plaque, due to things like a poor diet, a sedentary lifestyle, etc. And for many of us, by the time we reach middle or even older life, our risk has increased, and we may not even be aware of it because most people are asymptomatic. And this is why today we're talking about the importance of figuring out what your own risk is and early intervention. So, what I want to also highlight here is that I should have mentioned earlier, this graph is really showing you on the x-axis time and on the y-axis risk. So you can see with this blue line, which is denoting the conventional medicine pathway, that your risk increases over time. And traditionally, clinical intervention doesn't really begin until you start having symptoms. So, maybe you're short of breath, or maybe you're starting to have chest pains, or worse, you have your first heart attack and are surprised by it because you had no symptoms until it happened. So the traditional pathway really isn't looking at your risk until it's the later stages of the disease. And what we want to highlight today is that early intervention and changes to things like your lifestyle, dietary choices, and when and if necessary, working with your doctor. At times, you may need medication to help reduce your risk, basically, shift the curve of your risk so that you can spend more time in your later years with energy. We're really not talking about just avoiding heart attacks here. We're talking about having a really great quality of life as you move into your older years. And I want to emphasize again here that the power lies in your hands in reducing your risk. Okay. So here today we're going to emphasize the fact that early intervention and understanding your own risk profile can really make a difference in reducing your risk and optimizing your heart health. So here we're taking a look at 3 profiles of real individuals. And I want you to just take a quick peek at the information I've shared here and take a guess at which of these individuals do you think might have an increased risk for cardiovascular disease? And ask yourself, do you know your own risk? Just a couple of things to point out. These are all middle-aged individuals. They lead relatively healthy lifestyle and have a healthy diet. The main difference here is, of course, their gender and then their lifetime cholesterol levels. So you can see the 2 females have had a lifetime of high cholesterol, and the male has had normal cholesterol his entire life. And what we want to emphasize is that traditional risk, I've also included here at the bottom, the standard 10-year risk calculator. If you go to your doctor and you have high cholesterol and you're middle-aged, they may run this risk calculator, and it's based on certain data points like your age, your gender, whether or not you smoke, whether or not you have diabetes, maybe elevated blood pressure, and then it comes up with an estimated risk that you are going to have a cardiac event over the next 10 years. And as you can see, based on this traditional risk calculator, all of these individuals come in at a low risk. Um, and we're going to circle back to these three individuals towards the end of our presentation today, because all of them have gone on to take action and have further testing to kind of hone in on their own individual risk. And what I want to highlight here is that cardiovascular disease can look different from one person to another. And we all really need to go beyond how we look and how we feel, because you can have like the beginning stages, like plaque buildup in your arteries, and still feel great, not have any symptoms. Okay. So we're going to spend the next few slides talking about the causes of heart disease. And this may get a little technical, but I will walk you through how this ties back to actions you can take through diet and lifestyle to influence these causes. Okay, so I want you to take a second and think, what comes to mind when you think of causes of heart disease? For most of us, myself included, we're, I don't know if we're taught, but we learn along the way that, high cholesterol leads to plaque buildup, which leads to a heart attack. And we now know today that it's far more complex than that. Cholesterol itself is not the problem. It's really a metabolic and inflammatory disorder that is causing an inflammatory state in your body that makes it easier for the sticky cholesterol particles to enter and then get stuck in your artery wall. And that's the beginning stages of what's called atherosclerosis, or plaque buildup in your arteries. And as you can see in this visual, we're looking on the left-hand side. Here's a healthy artery. It's clean. You can see there's a lot of space for the blood to flow. But early stages, and remember, this is happening over decades, you can see that if you have poor metabolic health, if you have chronic inflammation, you have the potential for plaque to build up. And you can see here that the plaque is building up inside the artery wall, and it's usually silent. You have no idea this is happening. And this is happening again over a long period of time, and it's silent. And so we're going to talk later on about some tests that can detect these early signs of disease so that you can take steps to stop it in its track before it becomes, a bit more dangerous. Okay, so we're going to spend the next few slides walking through the importance of cholesterol, chronic inflammation, and metabolic health. Before we pull back out and then talk about what you can do starting today to to reduce the causes and reduce your risk for cardiovascular disease. So let's take a minute and talk about cholesterol. It's, I think, one of the most misunderstood factors of heart disease, because cholesterol is essential. We need it to build every single one of our cells in our bodies. We need it in the production of certain hormones like estrogen and testosterone. We need it in the production of vitamin D and even the bile acids that help us digest fat. So it's really essential for our body, and on its own, it's not a problem. And I've included this visual to kind of show you that there's two different kinds that we're focusing in on. I've also made a point here to show you that cholesterol doesn't really travel around in the blood, can't travel around in the blood on its own. It's carried in these little transport particles called lipoproteins. And there's two kinds. There's the LDL, and these are the particles that carry the cholesterol to your cells and tissues everywhere in your body where you need it. These are the particles that can cause plaque. And then the other kind, these HDL particles, have a protective function. Their job is to run around and remove all of the excess excess cholesterol and deliver it to your liver so that your body can get rid of it. Okay. Um, the main point here is we need cholesterol on its own, it's not a problem. But in an inflammatory environment, it can become a problem. And here's where we want to just mention the importance of inflammation. Inflammation is your body's alarm system. If you think about getting a cut on your finger, you your body is going to it's going to trigger your immune system to send out white blood cells and work to heal that injury. It's a protective mechanism, and in acute situations like a cut on your finger, you want inflammation. It is good. But if it goes on for too long, and this is where we're talking about chronic inflammation, it's like an ongoing state of irritation inside your artery walls. This is kind of what underlies many of the chronic diseases of today. It's it's irritating your artery lining, and by irritation, I mean it's cut or it's making little cuts and scrapes in your artery wall, kind of like that nick on your finger. And this is making it easier for those cholesterol particles that have a tendency to be sticky to enter and get stuck in your artery wall. And this is when the problem starts. Okay, so we have chronic inflammation, we have cholesterol, and one of the other causes is metabolic dysfunction. So the next few slides, we're going to talk about the importance of metabolic health. Um, One of the first stages of metabolic dysfunction is something called insulin resistance. You may have heard this term, and I want to spend just a minute explaining what this means. Think about after you eat a meal. Your body sends out a hormone called insulin, and it's a signaling hormone. It comes to your cell. So here on the left-hand side, we're looking at how it normally works in your body. Insulin is like a key that unlocks your cell door, knocks on the cell door, tells the cell, hey, there's fuel out here. Open the door and let it in. And if your body is functioning well, your cells are going to let that sugar in so that your little mitochondria can go to work, turning it into energy for your body. Now, what happens when you have insulin resistance? This is describing a situation where your body's still, you eat a meal, your body's still releasing insulin. It's still going and knocking on the door of the cell, but the cell is not responding, or it's not opening the door, or it's opening the door just a little bit. And so what happens? Your body sends out more insulin. It knocks on that door harder, and your cell may respond a little bit, but what's happening in the meantime is blood sugar is building up. Insulin, because your body is releasing more insulin to make a louder signal, insulin is also building up. And this is one of the earliest stages of metabolic dysfunction. And what I want to highlight here is there are tests out there that you can have, blood labs that can help identify if you have insulin resistance. And it's important because it can help you um, capture if you have an issue early before the disease has progressed into something more serious like prediabetes or diabetes. And clinics like BioLounge, include these sorts of tests in their standard lab package. If you go to your normal doctor, they may not think to run this for you until later stages, until you have a more serious issue. So another component of metabolic health is your mighty mitochondria. Now, some of you may recall from high school biology that the mitochondria are the powerhouses of your cells, and they are responsible for turning food into usable energy for your body. Now, why is this important for your heart? Well, your heart is one of the organs that requires the most mitochondria because it's working for you 24/7, and it has like an enormous demand for energy from these little mitochondria. So when your mitochondria are dysfunctional or damaged due to diet and lifestyle choices, your heart's going to feel it first. Okay, so um, we want to kind of tie this all together when we're talking about metabolic health and just reiterate the fact that insulin sensitivity and mitochondrial health are foundational to your metabolic health. And metabolic flexibility is the goal, and metabolic flexibility is just another way of saying being metabolically healthy, right? So, this is your body's ability to burn fuel efficiently, whether it's fat or sugar. And depending on whether you're just waking up from a night of sleep and you're kind of in a fasted state, or you're exercising, your body is efficiently able to utilize and tap into its fat and sugar stores. And when you are metabolically flexible, your mitochondria are efficient at burning both sugar and fat. Your insulin signaling works well, so the glucose can easily move into the cells, and your blood sugar remains stable, and there's less fuel backlog in your cells. So, what this means is less strain on your heart. Okay, so now that we've talked about the risks and the causes of heart disease, I want to move into actions that you can take starting today to reduce your risk and address your heart health. Sorry, I'm keeping an eye on the time to make sure that I'm staying on task. So here we're taking a look at a great visual. This is from the American Heart Association's website, and this is what's called Life's Essential 8. So these are the key determinants of heart health based on many studies. And I've also included, just to keep it front and center in our mind, the importance of oral health, because we know that oral health is directly connected to heart health. And we'll spend a few minutes talking about this later in the presentation. But for now, smoking and brushing your teeth aside, we want to talk about the three key drivers that influence the rest of these life's essential 8. So if you can work on taking steps towards improving your diet and moving every day and making sure that you're getting quality sleep, these three levers can help you manage things like your blood sugar and your your weight and your blood pressure. Okay, so we're going to spend the next little bit talking about these three levers and what you can do to improve your heart health. Okay, so let's start with the nutrition. Nutrition is one of the most powerful levers you have to improve your heart health. And we have many studies now showing how certain dietary patterns can reduce your cholesterol, can reduce that chronic inflammation, and improve your overall health. And I've included a phrase here by Michael Pollan that I love. So today, as we're walking through some of the dietary patterns, and even in the future, when you're looking at social media posts and feeling overwhelmed by all of the information out there, I'm hoping that you keep these 8 words in mind, because you can really distill a heart healthy diet down to these 8 words: eat real food, mostly plants, and not too much. Okay, now there's nuances. And of course, if you have food allergies or you have food preferences, you come to a place like BioLounge, they're going to, drill down into how to make this and turn this into a plan for you. But the bottom line is this simple. Stay away from processed food, try to get fruits and vegetables into your diet on a regular basis, and don't snack too much. Okay. So I want to spend just a minute talking about why the standard American diet is so damaging. Um, so when you think about the standard American diet, what most people are eating, we are relying heavily on highly processed foods. For any number of reasons. We have busy lives, we like the convenience, we love the taste, etc. What is the problem? The problem with these highly processed foods is many of them are stripped of the essential vitamins and minerals that you need to get from your food. They're stripped of fiber, but they have added in things like excess salt, excess sugar, um, and certain foods include too much saturated fat. And all of this is driving that chronic inflammation in your arteries. It's increasing your susceptibility to insulin resistance and it's damaging your mitochondria. How is it doing this? It's because these foods tend to generate what's called free radicals. And just think about these as sort of like creating inflammation in your creating inflammation in your body. And if you're eating a diet that's high in fruits and vegetables, then you have this natural way of tamping down and knocking back these free radicals because antioxidants can stop free radicals or at least, you know, tamp down their impact on your body and reduce the risk of, you know, chronic disease, cardiovascular disease, etc. So now let's spend some time talking about the well-studied heart healthy dietary patterns. There are multiple approaches to eating in a healthy way that is protective for your heart, and I'm including a few here from an article that just is really walking through these three diets. So the Mediterranean diet, the DASH or the dietary approach to stop hypertension diet, and multiple plant-based diets, which include everything from vegan, where you're really staying away from animal products, to pescatarian, where you're including fish. Now, these are all anti-inflammatory dietary approaches. And I am not going to go through all of the details, except to highlight that for the Mediterranean diet, it is based primarily around plant foods, so fruits and vegetables, nuts and seeds, with a healthy dose of extra virgin olive oil and also nuts. The DASH diet is similarly based around a rich amount of nutrient dense fruits and vegetables, whole grains, these healthy sources of of nutrients. And the DASH diet is really focused on reducing the sodium in your diet, reducing salt. So this diet was based on studies that help people who had hypertension reduce their blood pressure. It includes things like poultry, low-fat milk, eggs, etc. And then plant-based diets, as I mentioned, there are variations, and they all, again, are based around a healthy dose of fruits and vegetables, nuts and seeds, legumes, etc. And there is, I just want to include one more diet called the portfolio diet, which is basically taken from each of these well-studied diets that show, certain foods reducing cholesterol and tamping down inflammation, etc. The portfolio diet has taken the components that have proven to reduce cholesterol and they've turned it into like a portfolio diet. So, an X amount of nuts and an X amount of soluble fiber, these all add up to lowering your cholesterol. Now, this can feel overwhelming, but my main takeaway here is that all of these approaches have a lot of things in common. Number one, they are focused on, a wide variety of colorful fruits and vegetables. They're focused on healthy fats, and they're focused on a diet that's high in fiber, and they're all focused around an anti-inflammatory dietary pattern. Um, the other takeaway I want to include here is when you're thinking about, well, what does this mean for me? I don't want to give up my meat, or I don't want to give up my dairy. Great, don't, because there's so many variations that can help you get to a healthy diet that addresses your food allergies or your food preferences. Okay, so I'm including this slide here basically to try to simplify what we can be thinking about as we start thinking about what a healthy diet looks like. This also is from the American Heart Association's website. It's a great resource. What I want to highlight here is that this plate kind of represents what a typical day of eating might look like for a heart healthy diet. And the emphasis here is on half of the plate is filled with fruits and vegetables. And this is really where a lot of Americans are lacking. We just don't get enough fruits and vegetables in our diet for any number of reasons. And so I want to encourage you to think about, it doesn't have to be perfection. It doesn't have to be about removing foods. Just think about adding foods. If your plate should be half your plate should be filled with vegetables and fruits, perhaps today you start by adding an apple in, right? The other thing I want to emphasize here is that your beverage of choice should be water. So keeping it simple, think about getting more fruits and vegetables into your diet. Maybe a quarter of your food is whole grains, and then thinking about healthy protein sources. And I have included, a long list here. What might this look like for you? This is showing you, again, what we've already gone over, some of the more important foods to think about for a heart healthy diet, and as importantly, what we should be thinking about limiting. Now, what I've included in the limit column are things like thinking about reducing your salt and limiting it to less than 2,500 milligrams per day, saturated fat, limiting it to less than 10% of total daily calories. And you may be thinking, well, what does that mean for me? I have no idea of how to calculate that. I encourage you to either reach out to me or reach out to folks at BioLounge. They can help you craft a dietary plan that works for you. The other thing I want to highlight is that these limitations, which we know based on studies, really can go far in reducing your risk for cardiovascular disease, are really difficult to meet if you're eating primarily processed foods. If you're eating whole foods, this is very realistic. So over time, the more whole foods you can add into your diet, the better. And lastly, avoid trans fats. I think for the most part, these are found in baked goods and packaged goods, et cetera. So again, if you're trying to move towards whole foods, this is not going to be such a big concern. Okay, the next few slides, I've listed their lists of healthy foods for you to think about. We're not going to walk through all of them, but I am going to highlight some key nutrients that if you're following a healthy, heart healthy dietary pattern, you're naturally going to be getting healthy fats, for example. And what are healthy fats? I've listed some foods that include them, but these are your monounsaturated and polyunsaturated fats. These are your things like extra virgin olive oil and fatty fish that are shown to be cardioprotective because this is providing you with the omega-3 fatty acids that are anti-inflammatory and very good in protecting your heart. A couple of ideas when you're thinking about tiny steps you can take to improve your own maybe dietary pattern is thinking about swapping saturated fat with polyunsaturated or monounsaturated fat options. So using extra virgin olive oil or avocado oil for dressing or for cooking rather than something like coconut oil, which is really high in saturated fat. Okay, dietary fiber is also incredibly important for your overall health, the health of your gut microbiome, and of course, your heart health. And so there's two different kinds of dietary fiber. Um, there's soluble fiber and there's insoluble fiber. And this nutrient is really essential for, especially the soluble fiber, is essential for your heart health because the soluble fiber is, if you think of chia seeds in water, this is the fiber that becomes kind of like it makes a gel. And when it's going through your system, it is binding with cholesterol and helping to remove it from your body. So that's just one of the many benefits of fiber. And what I want to highlight here at the bottom, the recommended daily amount is at a minimum 25 to 30 grams or so. Most Americans, because we're relying heavily on processed foods that have had their fiber stripped out of the food product, most Americans are getting less than half of the recommended amount. And so by just focusing on fruits and vegetables, you're naturally going to be adding in fiber into your diet. Lastly, antioxidants. These are really powerful nutrients. We've already talked about the importance of these, but you're going to find these in dark, richly colored fruits and vegetables. That's kind of giving you an indication that they're high in antioxidants. I've listed a number of them here, and yes, this includes dark chocolate. Um, but the more fruits and vegetables you're getting into your diet, the more you are filling your body with antioxidants that help tamp down that chronic inflammation. Okay. Okay, we're going to spend the next couple of slides just touching on lifestyle before we move into some of the tests. Exercise. Exercise is one of the easiest ways you can improve your heart health. And I've listed the recommendations for weekly exercise, not just for heart health, but this is for everybody. And this is becoming more and more challenging in our world as we have technological improvements that are making it very easy to sit at your desk all day and literally use just your finger to order your food or to do your work. And I want to encourage you to think about not get caught up in these requirements so much as thinking about how can I start adding in more movement into my day? Because even, yes, the weekly recommended amount is 150 to 300 minutes of moderate activity or 75 minutes of vigorous activity and adding strength training in 2 to 3 times a week. That can sound overwhelming if you have a full-time job or you're trying to take care of kids and family, etc. But this 150 minutes really translates into about 20 minutes a day. And so what I want to encourage you to think about is even what's called exercise snacks. So 5 minute, a 5 minute getting up out of your chair at work and like walking around, walking up and down the stairs or walking to the bathroom. These things count. And trying to incorporate regular movement regularly throughout the day. There are studies that show when comparing somebody who works out 1 hour a day regularly, but otherwise is sedentary throughout the rest of the day versus somebody who gets that same amount of movement in their day, but it's in like 2 minute increments every hour, the impact on their glucose management is similar. And so, even though it may feel like in our world where we're talking about, ooh, we have to get an hour in at the gym, 2 minutes at a time may seem insignificant. It is not. It matters. And I want to encourage you to think about, well, what are things that I love to do that include movement that I can start incorporating into my day, whether it's gardening or dancing or getting out for a walk with friends, right? There are a lot of opportunities to build it into your day. And then sleep. I just want to highlight the importance of sleep. More and more studies show that this has a lot of cardioprotective benefits. I've listed some here. Um, the goal, and I know it's hard for many of us, but the target is to get between 7 and 9 hours of sleep. And studies show less than that or even more than that um, can negatively impact your heart health. And also trying to keep a regular schedule is important. And also, what I've noticed comes up in the clinic here at BioLounge is if you snore, you might think about um, whether or not you might have something called sleep apnea, which means you're stopping breathing multiple times throughout the night. Because this is something that's easy to fix, and it also is one of the easiest ways to improve your heart health um, and metabolic health, in fact. Okay, so we have covered exercise and sleep, and here I just want to touch on oral health because the evidence is very clear that if there's an imbalance in your oral microbiome, you have a microbiome in your mouth just like you do in your gut. And if it is out of balance and you have the little microbes in your mouth that cause periodontitis, I hope I'm saying that right, which many Americans have, we just don't know it, then you are at increased risk for cardiovascular disease. And so my main takeaway here is your oral health is incredibly important for your heart health and a critical component of your overall strategy in reducing your risk for cardiovascular disease. Okay, we're going to spend the next section talking about some key biomarkers and imaging tests that may, depending on your own risk profile, help you in your taking care of your heart health. So what I am sharing here are some of the standard biomarkers that if you go to your doctor and for your annual wellness check, they may run a lipid panel, for example, which is testing your total cholesterol and HDL and LDL concentrations. And maybe I should just point out what I'm laying out here. So these are standard tests. I'm noting here that they're standard. Either they're standard and you generally can get these from your regular doctor, or these are still important markers, but these are things that you can figure out at home. So blood pressure, for example, you can actually get your own at-home monitor. And I encourage you to do this because a lot of us, if we're just getting our blood pressure tested once a year, we may not know that we have an issue. And this is a common problem for many people, like heart disease. Blood pressure, hypertension is silent, and you won't know that you have elevated blood pressure. And this is really one of those, a big risk for cardiovascular disease. So as well, understanding your waist circumference, which is kind of a proxy for the fat that we don't want around our middle, excess fat. We all have fat around our middle, but excess fat. So ideally, I haven't included optimal measures here, but for your waist circumference, ideally for males, it should be less than 40 inches. For white males, and for white women, it should be less than 35 inches. I also have a handout that I can share that has a more extensive list of all of the biomarkers we're going to walk through, what they mean, and why you might want to talk to your doctor about them. So what I'm showing you here again are standard tests that you may be able to get with your doctor. And these can detect early issues. And I'm just kind of highlighting here what they're testing for. So these obviously are testing for your cholesterol. Some of these down here are testing your metabolic health, right? Fasting glucose is what's going on, how much sugar you have after a fasted, like 8 to 10 hours fasted state. Um, your cholesterol levels. Now, I'm not going to spend a lot of time on these because in our next slide, which we'll move to now, I want to highlight a couple of tests that are better predictors of your cardiovascular risk that are also measuring cholesterol, but in a different way. So ApoB stands for apolipoprotein B, and this is basically a marker that measures the particle number of your cholesterol, and it's an important, more accurate predictor of your true risk. LP little a is another important marker related to your cholesterol. Now, this is a genetic marker, and we recommend that people have this tested at least once in your life, generally just once in your life. And it's you either have a high level or you don't. If you have a high level, this just means that you may want to, dig a little deeper into your risk and understand if you need more aggressive treatment, because this is an indication that you have the stickier, more dense particles of cholesterol. Okay, and then I'm not going to go through all of these tests, but you can see that, just like we had talked about some of the drivers for cardiovascular disease, inflammation, metabolic health, etc., these tests can kind of identify if you're having issues or not. And some of these your doctor may run, like HbA1c is a measure of the average of your glucose levels over the last 3 months. But some of these other inflammatory markers like homocysteine, your doctor, this is not going to be part of a standard a standard panel if you go to your doctor for your wellness check. However, I want to highlight that at clinics like BioLounge, this is part of their standard package. They may run these inflammatory markers. They definitely are going to be running things like homocysteine and HSCRP, which is another marker of inflammation in your body. Now, some of these, the last four markers that I have listed here, I'm not going to go into detail, but I will include on the handout. These are, if you get some of these advanced tests and identify that yes, you do have a bit of an increased risk for cardiovascular disease, then these are additional tests that you may want to run that give a better indication on, like, do you have inflammation in your vascular system right now? They can better hone in on what your true risk is. Okay. Now I want to talk about some imaging tests that you can have done. And I want to highlight that it's just a preventative approach for folks like me, in fact, who seem healthy, don't have symptoms, but may actually have early signs of the disease. And so today we're going to talk about two early screening tests that you can have done. And again, I want to highlight that clinics like BioLounge, if they have walked through your health history with you and helped you identify that you might be at increased risk, these might be standard tests that they'd consider running for you. But what I want to highlight, the two that we're going to talk about, is this coronary artery calcium test and this carotid US test. And what I like about this visual here is, again, we're looking at a artery over time, right? And so this is showing you a pristine artery wall. So this is like in the early years. And this is where, as you can see, it's saying clinically silent. This means the disease may have started, but you can't tell. And if you were to go to the doctor, they're going to have no way of knowing, or generally not going to consider testing for these early signs of disease. But as you can see, this test that we're going to talk about in a minute can catch these early signs. And then in the later stages, clinically overt or silent means you may or may not have symptoms, right? And they may or may not be capturing it at your doctor's office, but you can have this test called the coronary artery calcium scan run. And this captures, this is more calcified plaque, so it's older plaque that's been there for a while, but still, these are tests that are not traditionally run. And you can get these, they're usually not covered by insurance, but they're not more than a couple of $100s, and they can really the importance of them is they can help refine and help you understand what your true risk is so that you know whether or not you need to be more aggressive in your approach towards your heart health. So here, all I want you to really focus in on is this visual here. We're talking about the carotid intima media thickness scan, and this is basically a scan of your neck arteries, and it's checking for any plaque buildup. This is again the early stage in your artery wall, right? And this can identify if you have the softer, it can be more dangerous plaque because it's less stable, but it captures both soft and hardened plaque. That's one test. And then the other one is called the coronary artery calcium scan. Again, these both are non-invasive tests. This one is measuring the amount of calcium in your coronary arteries. And this test will give you a score. And ideally, you want to see a 0. If you see a 0, that means you basically have no calcium in your arteries, and that's a good sign. Especially if you're older, that's a good sign, right? And if you have anything over a score of 0, that gives you an indication that you have calcified plaque in your coronary arteries, and this can help you and, in partnership with your doctor, determine the next course of action. This actually was the test. Both of these tests helped me determine that, I have had a lifetime of high cholesterol, and it helped me determine with my doctor that, yeah, I should definitely consider dietary changes. And if not that, maybe consider a baby statin even, because these found that I did have plaque buildup. So certainly helpful and can certainly help you reduce your risk quickly. So now let's come back to the 3 individuals that we had looked at the beginning of our presentation today, and take a peek. All of these individuals went on to take the tests that we just talked about, and so here are their results. As you can see, the older female came back with a coronary arteries calcium score of 0. So because she's 65, it's a really good sign that she, at this, middle age, does not have calcium buildup. And she is going to go on and get a CIMT test, but her doctor said, we can wait a little bit for that. Now, the other 2 individuals both found that they had calcified plaque buildup in their coronary arteries. So their CAC score is not 0 here. And you can see that the CIMT test comes back. It kind of measures the thickness of your artery wall, and it gives you an estimated arterial age, comparing you to a cohort of similar individuals. So the male who had a lifetime of normal cholesterol, you can see he did have some damage and calcified plaque, but his overall plaque burden came back and showed that he had an artery age almost 20 years younger. Whereas the middle-aged female had a CIMT score showing that her age relative to women, her age was older. So she had more plaque. And even though the traditional risk calculated her risk as low, really, when you look at it, her risk was a little higher. Now, this person has gone on to make changes to her diet and also has gone on to a baby statin, which is again reduced her risk back to low because the high cholesterol is now under control, right? And she's working with her doctor on ensuring that the plaque buildup is basically they can make sure that there's no more plaque buildup. They're stopping it in its track with both diet and lifestyle approaches as well as a little bit of medication help. Okay. Excuse me. We've been through a lot today, so I'm trying to make it really simple. Excuse me for just a moment. And let's call this your heart health playbook. 5 steps you can take to reduce your risk. Let's simplify. Try to move daily. Try to find opportunities to eat real food. Take advantage of the tests available out there and test and measure early to identify your own risk. Protect your waist by eating healthy foods and moving regularly, and then prioritize recovery. So, make an effort to prioritize sleep. Now, what can this look like in the real world without it feeling overwhelming? Because it isn't about the perfect diet or the perfect exercise routine. It's finding ways to add these little bits of change into your daily practice. So, as I highlight here, small shifts equal big transformational gains over time. So, for example, replacing one meal of processed foods with whole foods, or even adding a cup of vegetables to your dinner, or including an orange or an apple at lunch. All of these little additions make a difference and add up. Walking just 10 minutes after meal can make a significant difference in your body's ability to manage post glucose, so sugar, your blood sugar after eating. Trying to add in a little bit more sleep at night, even if this means, getting ready for bed 10 minutes earlier or 15 minutes earlier. And then when the daily stresses add up, trying to find a moment to pause and breathe. Okay. Um, so we've been through a lot today, and I want to encourage you to think about if you're interested in making changes or incorporating some of these tests into your routine and figuring out what your risk is. I encourage you to consider working with BioLounge nutritionists, or if you have questions, reaching out to me. We're here to help you on your heart health journey. But I do want to leave you with just an idea about how powerful tiny changes can be in your own life, and that it you can start with tiny habits and on your own be impacting your heart health by making tiny changes. So this little visual is thanks to Stanford behavioral psychologist. His name is Dr. Fogg, and he had an awesome TED Talk. I'm happy to share out the link if you're interested, but he basically talks about the power of tiny habits. And he is basically saying for long-term change, you don't start with a big, hairy transformational change. You start with something really, really tiny that takes very little effort, that doesn't require a lot of motivation. You link it to, something that is some part of your daily routine that is already happening in your life, and make a point of celebrating afterwards. And this is how you can help introduce change into your day. For example, I have here at the bottom just kind of a way of thinking about how to come up with one of your own. For myself, I had a tendency to forget to drink water until too late in the day, and so I wouldn't drink as much as I needed to because I really didn't want to be up all night going to the bathroom. So I use this to help improve my water intake earlier in the day. And what I did is I his approach is this: think of a change that you want to make. So for me, it was improve my water intake over the day, make it tiny. So for me, it was okay, 1 glass of water. I want to just add 1 glass of water a day. Um, and then go through your daily routine and think about what are some of the habits that you perform every single day without thinking, and find a way to attach the new behavior change you want to make to that existing behavior. So your anchor. And then after you make that change, celebrate. So, for example, for me, it was after I start the coffee maker in the morning, I will drink a glass of water. So, down here, after I start my coffee, I will drink a glass of water. And then you celebrate with a great job. Or in my case, I just thought about the little cells in my body that are absorbing that water and are very happy. So, okay, silly but effective. Um, my key takeaways, I see that we're out of time, so let me just finish with emphasizing the fact that heart disease is preventable and it is never too early to start. Early detection and prevention drastically can reduce your risk for cardiovascular disease, and small steps add up to powerful change. Um, that's all I have for you today. Thank you so much.
Marion, thank you so much for this. This was great. I want to tell you that I was on my walking treadmill while I was listening to this, trying to get my exercise snacks in. And I start my coffee maker and then take my soluble fiber so I don't forget. So my
Me
soluble fiber
too.
sits next to the coffee maker.
Ah,
Otherwise, it never happens. So it reassured me that I was working on some of these things that are really pivotal to behavior change. But the presentation that you just offered our patients was so meaningful because it it helps people see how realistic this is.
I hope
And it's a
I hope I
playbook.
said that enough. I
It's
hope.
a playbook. And you know what? It's screening, it's action, it's little bits at a time, right? And this is really, truly, I think people do not understand the magnitude of risk we have in cardiovascular disease because it is
No.
silent. So I'm hoping that everybody that listens to this, either today or in the future, when I send it out to the people that knew they couldn't be here today, but they wanted the recording, that they really um, take into account how potent and powerful this is to help them prevent the things that they can be preventing so early, so they get that last 30 years without having to manage disease, right? Isn't that what we all want? We want that
Yes.
last 30 years
Yes, yes,
disease
yes.
free.
Yes,
Yeah.
and the thing is we don't think about it until like way down the line. Like, you
Yeah,
know,
we don't. We
I
don't think about it in conventional medicine until the diagnosis has been made in almost all chronic disease. And once the diagnosis is made, the disease has been brewing for decades. So, as you said today multiple times, and I appreciate in functional medicine at BioLounge and the work you do and the work I do, the goal is to identify the problem as early as possible so we can start changing the trajectory before it takes hold and we're kind of out of options. So thank you from the bottom of my heart for being here today and for putting this together because it was really, really meaningful.
thank you. That means a lot hearing that from you. Yeah, thank you so much. Thank